apologize about that. I literally just remembered something and I thought I did something wrong. And what I was saying was, if you have bloating, that means that your stomach may have issues with stomach acid production, because when you don't produce stomach acid, you're not going to be able to digest the food that you just consumed. Or if you eat really fast and chronically your digestive function is compromised, then you can have bloating. Now, that type of bloating actually is that comes from the stomach, is going to happen pretty much between 10 to 15 minutes after eating, up to about an hour to 2 hours. That is when you know that you have digestion problem at the stomach level. Now, if you eat and you have bloating about an hour and a half to 2 hours, 3 hours later, that usually means that your stomach is fine. Is that it's your small intestine. You have a small small intestinal bacteria overgrowth or yeast overgrowth. So yeast can also grow into your small intestine. And when that food hits the area where there's bacteria overgrowing or yeast overgrowing, guess what? Those organisms starts to ferment the food. They start to break down the food. But anytime you break down food, you produce waste product. And most of the time, the waste product that these bacteria produce are gas. Specifically, there are a couple of bacteria that are known to cause issues with bacteria overgrowth, which is Clostridia species and Methanobrevibacter smithii species. Some of them produce hydrogen gas, and then some of them produce methane gas. And then there's a type where you can have hydrogen sulfide gas, which is where you have organisms that convert the food that you consume into sulfur. That is the most severe form of small intestinal bacteria overgrowth. And so any of the overgrowth can cause you to have distension and bloating of the stomach. Now, these usually make you look like you're pregnant because it's the small intestine. If you stretch out the small intestine, it's the size of 2 tennis courts. It is 20 feet long. So imagine if gas are filling up this tube that's 20 feet long, it distends, right? So that's why you have these severe bloating. When you have this type of bloating, it is because of bacterial overgrowth. That's why this IBS diagnosis is really misleading, because people think like, I have to live with this, there's no treatment for it, and then you can get medication, but really medication usually doesn't work for this condition. It can control it sometimes, but it typically doesn't get rid of it because it's not treating the root cause. You're just covering up with the symptoms. Then you end up with side effects because guess what? They treat these conditions with PPIs, like proton pump inhibitors, which then shut down your own stomach acid production, which then leads to indigestion of your food, right? You can't break down the food because you don't have stomach acid. And now you have problem with extracting nutrients. So that's why these drugs, they're only meant to be taken 4 weeks at a time. Again, only to cover symptoms. But most of the patients who get put on this drug never get off of them, because if they get off of them, there's a rebound effect. Their symptoms worsen, and there's a whole like downstream effect that really impact their health. Not to mention, there's associated risk of Alzheimer's that has been found to be linked to PPI use, right? And then, so food intolerances and sensitivities can also trigger the symptoms that you have under the IBS umbrella. Well, food intolerances and sensitivities is due to leaky gut. So once your gut is dysfunctional, they can get damaged. So NSAID use, medication use, glyphosate, gluten, dairy, stress, concussion actually can cause your gut intestinal permeability to be increased, where more food or more toxins can leak into your bloodstream and then cause your immune system to be activated, because now these things that are leaking in can be food particles, and these food particles aren't digested well. So now your immune system looks at them and like, this doesn't belong here. This is not what I recognize. So now you start to, your immune system start to attack the food and tag it as a foreign invader. This is why some of us develop rashes or fatigue or brain fog or anxiety or depressive mood, even when we have leaky gut and we consume gluten. And that is because depending on your genetics, this is where genetics can play a role. It will manifest as different symptoms when you're exposed to the same environmental toxin. So I have rashes when I eat gluten, or I used to, but someone else can have brain fog and anxiety. That is because that's the difference in our genetic makeup. So I said stress and anxiety and nervous system dysregulation. This is where stress can cause leaky gut. When you deal with a lot of stress for over a long period of time, you're going to start having a lot of gut dysfunction, because the chronic stress response put your body into at that chronic state of sympathetic tone where you're always in fight or flight response. Well, as I shared with you, that's where all the blood is shunted to your muscle and not your digestive system. So then you just have a sluggish digestive system. And anytime you have inflammation in the gut, that communication or that inflammation can be sent up to the brain via the vagus nerve, triggering anxiety. This is why anxiety is not a mental disorder, because most of the people that have anxiety or panic attacks, they have it out of nowhere. There's no emotional triggers. There's nothing in their life that they can identify that was a triggering event for them, like emotional event for them, but yet they still have these random episodes of anxiety and panic attacks that came on. That is because it's not in our brain. It is not an emotional thing. It can be, but most of us are not dealing with that all the time. So the other source is the gut. And the majority of the anxiety and depression that we're dealing with is coming from the gut. And then impaired gut motility and digestive function. I kind of mentioned this with you about how when we don't digest our food well at the stomach, and then food goes on to the small intestine, causing you to have symptoms. So the treatment of this is you got to treat the underlying cause. But conventional medicine, when I was practicing it, we were not taught, we didn't even know what SIBO is, or small intestinal bacterial overgrowth is. We don't even know food intolerances. We don't even know dysbiosis. So this is why you want to work with a functional medicine doctor or naturopathic doctors. They treat the gut too. And instead of spending your effort on medication, your resources and money on medication and conventional treatment, and getting all those endoscopy and colonoscopy, which is so invasive, and those solutions that you drink to go get a colonoscopy, so toxic. Just look up the ingredients and see it for yourself. Look them up. I didn't make this up. I'm just sharing with you the data, right? And then dietary modification. So at the beginning of these treatments, you need to modify your diet, because you cannot get better if you keep eating food that is causing the problem. Now, low-fat, FODMAP diet and elimination diets are usually pretty effective while you're treating. So if you know how to treat this right, so I use an herbal protocol to treat these conditions and clean up the diet. And then some people will do, like, pretty much all their symptoms will go away. However, some people can go on and be able to eat more food, add more food back into their diet, and some people can't. And that is mainly because there's something else going on. A lot of times, what makes your gut favorable for bacteria to overgrow into the small intestine is because there's a presence of parasitic infection. Now, stress management is really just learning to be mindful about what you're eating, what you're putting into your body, slowing down, vagus nerve stimulation so that you can stimulate digestion in your body to happen. So you have to actively stimulate it to turn down the sympathetic tone and turn up the parasympathetic tone. You could do this with essential oils. I love essential oils. They're so effective. They work right away. You can use technology. I have a vagus nerve stimulator that we use. And you just find what works for you. You find what works for your budget and you find what works for your lifestyle. I don't really like using technology for this purpose. When I was dealing with reversing my lupus and my leaky gut, I use a lot of essential oils and I do a lot of detox, which we will go into later, and medications. So I have to put this in here because this is what conventional medicine use, these antispasmodics, laxatives, and anti-diarrhea medication. They only treat symptoms and they will produce side effects. Don't use these for relief because they're temporary and they can cause more harm and dysfunction to your system. All right. So there's irritable bowel syndrome, IBS, and then there's IBD, or inflammatory bowel disease. This is when you have chronic autoimmune disease that cause inflammation, where it's damaging the gut lining. And then we have two types, Crohn's disease and ulcerative colitis. Now, basically what this is ulceration. The damage is so severe that it's not just leaky gut where you have microscopic holes formed in your the barrier, but now you have big holes like ulcers that are happening throughout your gut lining. Now, Crohn's is mouth to anus. It can literally happen anywhere. They can have ulcers in the mouth all the way down to the anus. Ulcerative colitis is more just staying in the colon. I have patients in both cases, but the biggest thing with these guys is that they deal with the same symptoms: abdominal pain, diarrhea, sometimes bloody, weight loss, fatigue, fever, fistulas. This fistulas is where the lining is so damaged that they form abnormal connection from one part of the gut to the other part, abscesses, and bowel obstruction. So these are very dangerous because when you have a flare-up, most of these patients have to go into the hospitals. Now, when I was working in conventional medicine, I feel for these patients. They're in so much pain. And then we would have to use so many different drugs, like anti-pain drugs, opiates, but also a lot of antibiotics. And as you have learned, or just have learned, that antibiotic is contributing to the whole dysfunction of the gut. Now, if you look at root causes, or actually, let me go back to the consequences. The biggest consequences that these patients have is just dealing with the physical symptoms, but they are malnourished. They're not absorbing their nutrients because all of their linings are all inflamed. They can't absorb nutrients while it's all inflamed, right? Mineral, vitamin deficiency, increased risk of colorectal cancer, because when your system is constantly inflamed, your immune system is so active, guess what? There's a higher rate of cell turnover. That means your cell die and then they come back, they cell cycle. Well, that process, when uncontrolled, eventually when it happens too much, it literally will grow out of control. And that's when you can develop colorectal cancer. But colorectal cancer, believe it or not, can be reversed without chemo, without radiation, without surgery, if you know how to treat it right with lifestyle and detoxing. And then chronic disability. When I was in conventional medicine, this is where I see a lot of disability when people have this, and especially in young kids. It's so sad to see that their whole life now is to deal with this, and they're in so much pain. It affects their school, their life. But in functional medicine, a lot of my colleagues, myself, we are able to reverse this just from lifestyle and treating the gut properly. Now, the root causes of this is definitely part genetics. You have to have genetic predisposition. Now, I said earlier, genetics do not cause disease. They don't. Genetics in this, what I'm talking about here is that when your body is dealing with infection, bacterial overgrowth, yeast overgrowth, toxins that is in your gut, that environment right there will turn on genes that cause you to have an overactive immune function that's always activated. That's what leads to autoimmune attack, right? And then that's what leads to all these inflammation and the damages, is that the genetic factor is that the genes get turned on, and then protective genes get turned off. Because in this state, your body's just like, I need to protect myself. I don't care about anything else. Let me just turn on all the immune function as much as I can to deal with this. And that is where your immune system gets confused, is because these high toxic burden in the gut is causing it to just go into a state where this is the last resort. This is all I can do right now. And so when you don't know how to manage this condition properly, the outcome is always surgery or just a lot of opiate drugs. And this is where we start having problem with drug addiction, is conditions that have chronic pain like this, right? And then you have reduced microbial diversity and overgrowth of pro-inflammatory pathogens. So again, this is adding on to your toxic burden that then trigger your immune system to go into overdrive. Leaky gut or increased intestinal permeability is one of the contributing factors. It is not the root cause, but it is definitely a contributing factor. What I see though is that people who have parasitic infection are the people, and very specific types of parasites. I don't know which parasite, but when you deal with parasites, doesn't matter what type, it's when that parasite interact with your genetic makeup that will then manifest as these disorder, these inflammation. So what you need to treat is just get the parasites out, right? And that's where I get the most success with all my patients with inflammatory bowel disease, is treating parasites. Everything else is always just temporary. Same thing with small intestinal bacterial overgrowth. If you look at my colleagues, doctors who treat SIBO or small intestinal bacterial overgrowth, we all have very similar rate of success. About 1/3 of patients will resolve their SIBO, but 2/3 of patients will always have relapse. And we really didn't know why. When I started treating SIBO about 4 years ago, some patients will do really well, and that 2/3 will always come back. Well, ever since I started treating parasites, their SIBO resolved for good. That is because parasitic infection is a lot more prevalent than we know. And then when you get rid of them, you create an environment where your body can heal. Because as long as the parasites are in your system, they steal your nutrients, they release toxins, but they are there. And when as they actually hook onto your intestinal wall, causing the tissue to be damaged themselves. So you can see that there's like an anatomical problem, but also there's an impact of the toxins they release. And when they're there, they cause other bacteria in the gut to be more aggressive because they have to protect themselves too, right? So this is where I can tell you our program is different than other programs, is because we really look at treating parasites. But you can't just treat parasites and start doing a parasite cleanse. You definitely want to work with someone who knows how to treat them, because there's a process. You can't just start killing them, because you can have a lot of side effects. If you pass too much parasites at one point or one time, you can have rectal prolapse, because there's just a lot of parasites. Like I have a patient who passed 60 parasites in 2 weeks. And she actually had rectal prolapse because she didn't listen to me. She was so eager to get these out that she took my protocol, but she also took medication, which then caused her to pass way too much at one time. And that's why I don't use medication to treat parasite, because parasites in the genetic makeup and how they're actually very similar to us. So you kill them, you also killing part of your tissue as well. So I use herbal protocol. They take a little longer, but you want to get rid of them and support the body at the same time for you to get optimal results. So the treatment for this is usually, if you look at conventional treatment or even a lot of functional medicine treatment, is just to control the inflammation. You clean up the diet and then you give them nutrients or supplements that will help turn down the inflammation. You heal the gut lining with specific probiotics, prebiotics, but all of this will only temporarily treat the symptoms. If those patients stop taking the supplements or stop eating well, guess what? They will have flare up. But if you want to treat root cause, which is parasites, hidden infections, so other infections can also cause ulcerative colitis and Crohn's. But if you get rid of the root cause, then you have a high chance of really resolving the symptoms once and for all. And when I say high chance is because sometimes the damage has been so significant that you can't really fully reverse it, right? But people who catch this early and they go into treat the right treatment properly early, those are the ones that do really well. And so you can see here, conventional treatment, we use medication like steroids, which you can't be on long term, right? Biologics, which pretty much shut down your immune system, increasing your risk for other disease, other infections, but really eventually you're going to have to change drug and they always have side effects. And you never, the toxic load that is still coming from the gut and the parasitic infection or any other hidden infection, that's going to make you feel awful because the biologics and all these drugs don't really manage the effect of those infections. Okay, I as you could see, I have a lot to say about these. And then we're now getting to small intestinal bacteria overgrowth, which now I think you guys are pretty informed about what this condition is. But this is where you have abnormal amount of bacteria growing into your small intestine, which really there shouldn't be a lot of bacteria there. And the bacteria that start to grow there, they're there because they're aggressive, right? And they're there because the environment in the gut is favorable for them to grow. And so the symptoms you get is gas, bloating, abdominal pain, diarrhea, constipation, malabsorption, nutritional deficiencies. You guys are seeing the pattern here. It's very similar dysfunction. We just give them different names, right? And that's where I find conventional medicine very frustrating because giving people diagnosis, again, makes no difference. If you know what the diagnosis is, but if you don't treat the root cause, what's the point, right? You're just still managing and treating the symptoms with a Band-Aid. And then the consequences, again, nutritional deficiencies, leaky gut, chronic inflammation. And if you look at the impact of SIBO, is that it will add more toxic load to your liver. Then you're going to start to have symptoms that are outside the gut, like sleep issues, not sleeping at night, not being able to fall asleep. Because when you have these symptoms, your body is very awake and alert because it's dealing with something. It's trying to tell you like, hey, something is wrong, right? And then so you have sleep issues. You can have a lot of immune dysfunction. You start to have higher risk or get sick easily, right? You can have other organisms that normally doesn't cause diseases in us. They start to cause problem because our immune system is compromised, right? And then you can have food reactions. So SIBO is notorious for causing a lot of food sensitivities, food allergies, especially if you have a lot of, if you consume food that has high oxalate, salicylates, or sulfur, because these bacteria will convert those compounds from plants. They exist in plants too. But because these bacteria produce some of these compounds as well, you now have too much in your system, causing a lot of issues. You can also have, this condition can also increase your vagal tone, which is your sympathetic system, because you're in a stressed out state. Your body is turning on your fight or flight response. And then you can have IBS symptoms. This is why I mentioned with you earlier, like how all of these symptoms are really connected to very similar root causes, but conventionally, we don't know how to look at these conditions at the root cause. We just know how to treat symptoms. With SIBO, a lot of what people deal with is going to be impaired gut motility. This is where I see my my most severe constipation patient. This is what they deal with the most because their gut is compromised. The nervous system in the gut is compromised. And then you can have adhesion, so a lot of inflammation, chronic inflammation. After a while, you start to have tissues sticking together. Your fascia are all clogged up, your lymphatic system is all clogged up, leading to systemic symptoms. So headaches is a big one with SIBO, but anytime you have a high toxic burden, headaches is one of those symptoms that will manifest. Pain, like fibromyalgia pain can come from SIBO. And if you really think about it, right, if all the toxins are clogged like a toilet and the toxins back up into your system, guess where they go? They go back into your organs and tissues. And this is where you start to develop systemic symptoms. And you can get systemic diagnosis like rheumatoid arthritis. This is where you have toxins get stuck in your joints, and then your immune system start to attack those joints. So rheumatoid arthritis is also a gut dysfunction. All autoimmune disease actually start in the gut. Anytime you see an autoimmune disease, Hashimoto's, MS, lupus, it all starts in the gut. And then you can have medication like proton pump inhibitors and opiates can also cause SIBO, because when those are basically man-made causes of causing the gut to not have bowel movements, where you just like opiates, you just get constipation from using opiates. So does proton pump inhibitors. They just shut down digestion. So that's why it'll lead to a very sluggish bowel movement, which then give the opportunity for these bacteria to migrate up into your small intestine, because you're not passing bowels. I said all the toxins and bacteria in the colon, they start to move upward and out into the other system. So in here, you see underlying conditions like diabetes and hypothyroidism. They're not the root cause. They are actually a manifestation of something going on in the gut as well. So again, high toxic burden leading to diabetes, hypothyroidism, and once you have those, it may look like they cause SIBO, but they don't. But I need to mention this to you guys so that when you guys see the information, you can distinguish for yourself what is the real root cause and what is not. So again, root cause is going to be hidden infection, right? Mostly it's going to come from parasites or and parasites could be worms, but it could be also the eukaryotic parasite, which is a single cell organism. They don't cause as much problem as worm or intestinal parasites, but they do change the environment of the microbiome. Now, the other piece that I haven't mentioned is mold. Mold is known as the great mimicker. And once you get exposed to mold by just maybe sleeping in an old hotel room or went to an old school that had mold, you breathe it in. And most of us can actually deal with mold very well. Only 25% of the population doesn't have the right genetics in their liver to detox mold properly. Those people would get very sick when they get exposed to mold. But in general, we get exposed, we breathe it in. They can also get in through your skin, but it's when you produce mucus, that mucus drip down your throat, you swallow it, gets into your stomach. Now you have mold part of your microbiome. Most of the time, if you're healthy, it doesn't cause any problems. But when you start to develop a lot of dysfunction, that's when mold can become very problematic. So the treatment for SIBO is addressing the underlying cause. So you improve motility, you restore stomach acid so that you can digest food properly. And while you're treating, you have to be on these very specific diets so that you can manage the symptoms, because a lot of the symptoms that manifest in these conditions is due to what you eat. And it's not the food is the problem. It's just that food is now a triggering problem. It is not a root cause. And most of us, when we have these conditions, we think, oh, it's the, it's the gluten I eat. I just need to avoid it, or dairy. Yes, that's true, because those foods are inflammatory, but those are not the root cause. You're reacting to them because there's something else going on underneath. And then antibiotics, I don't use antibiotics. This is what some conventional medicine doctors who know about SIBO, they would use antibiotics. The thing is, 1/3 of patients will get better. However, they will always have problems again because they didn't treat the root cause. It only temporarily reduced the amount of bacteria that are overgrowing. And if that person pretty much don't change their lifestyle, they're going to have problems again later. It may be a couple of years, but they will always almost have problems again. So prokinetic agents like ginger, iberogast can be used to help stimulate patients with constipation symptoms. However, again, just treating the symptom. When you treat these conditions at the root cause, you shouldn't have to use a lot of the supplements to help manage the symptoms. Your symptoms will eventually improve, but if you maintain your lifestyle and eat healthy and manage your stress and all those good stuff, you're going to be able to resolve the symptoms once and for all. And then probiotics, you're going to have to stay on a probiotic, or you just eat a very diverse diet. So lots of kimchi, lots of fermented food, but a lot of times these patients, they can't handle those food when they're dealing with this. You have to treat the root cause first, then you rebuild the microbiome with your diet. Okay. And when I say diversified diet, that's like eating 20 to 30 different plant-based food a day to get the diversity that you need to rebuild your gut microbiome. That's when targeted probiotics is going to be useful, because most of us cannot eat that much plants or servings of vegetable. And you need to eat 7 to 10 servings of plant-based food a day to really have a big impact on your gut microbiome. I tried that. I cannot eat that much. Okay. And then we have diverticular disease. Now, this is an anatomical disease where you can have like these out pockets that grow out of the colon. And this is because the colon itself got weak. So, and then these pockets, and especially if you have a lot of constipation or stool compacted, it's going to start pushing your tissue out. And then these now become areas where it's vulnerable to inflammation, because then stool can get clogged up in there. And then over years, you just get a lot more bacteria growing there, and that stool gets stuck in there, and then it's just a breeding ground. And then guess what? That area, you're still going to reabsorb some of the toxins in these pockets, and that's why it's going to contribute to your overall health, right? So, and when it becomes inflamed, this is where you get diverticulitis. Oh, and it can bleed as well. And then this is where you can have internal bleeding. And for men especially, men are more vulnerable to this. And then they get chronic anemia, right? But a lot of times, once you're in your 50s, this is when these kind of disease start to develop. You get colonoscopy, and then you find out that you have them, or they have symptoms of, again, abdominal pain, bloating, change in bowel habits, or rectal bleeding. See, it's the same symptom, just present differently, but same root cause, right? And so when you have the biggest thing that you need to be concerned about here is that it's infection, right? Inflammation, bowel obstruction, because these things can cause anatomical obstruction, perforation, and abscess formation. And so root causes of this is low fiber diet. Well, the reason is when you have a low fiber diet, you're not feeding the good population of bacteria, and all the bad bacteria is being fed by all the junk food or the meat that you consume, or, processed foods. That's why low fiber diet is a cause of this, but it's not a direct cause. It's an indirect cause because it impacts the gut microbiome. chronic constipation. So again, stool just sitting there, it's going to go somewhere. It's going to back up and cause abnormal formation of these diverticulosis. Aging is not the cause of any diseases. Aging is a byproduct of all the dysfunction that we have in the gut. We can have also accelerated aging. You see people who look a lot older than their age. That is because the gut is not working well, and then they have chronic inflammation, which then lead to aging. But aging does not cause any diseases, and that's what we've been told by your doctors, by people who train me, that aging is the problem. Aging is not the root cause of any problem, but I want to put in there so I can tell you that aging is a byproduct out of these dysfunction. Obesity, not a direct cause either. Obesity is associated with these conditions because the root cause that caused diverticulitis is also the root cause of obesity, right? And then there's medication. I mentioned NSAID, steroids, they cause damage and weakening of our tissue in the gut. So you would, in order to address this, a lot of times you can just address it by increasing your fiber, increase fluid intake with that, probiotics, prebiotics. Most people will get better if they just change their diet. I mean, that's how powerful food is. Just change your diet, remove all the inflammatory food, and add in healing food. You can get reversal of these dysfunction by 80, sometimes to 100%. But when you don't get better, that's when you really want to look further and look at what else am I dealing with. And then antibiotics is used for acute diverticulitis. I try not to use antibiotics, but sometimes I have to if it is severe enough. But in general, if I have time, if it's early enough, I can use an herbal protocol. And herbal protocols, they kill off the infections, but they also give you other nutrients that will help you heal and provide what is needed, all the resources that is needed for your body to heal on its own. That's why I don't use antibiotics, because if you just use antibiotic alone, you are only killing off things, but you're not giving your body the resources that it needs in order for it to heal. So that's why after antibiotic treatment, most people, they feel a little bit better, but they never really recover fully. And then surgery is indicated for really severe cases. But like I said, if you treat parasites, hidden infection, change your diet, change your lifestyle, a lot of times surgery is not needed. And then lastly is hemorrhoids. So I believe that women in general are more sensitive to getting hemorrhoid because of estrogen and because of having babies, and so much pressure pressing down, and then chronic constipation, right, can also cause hemorrhoid. And then some of the symptoms you experience is that you can have an actual hemorrhoid sticking out and you can feel it, but that hemorrhoid can be irritated, it can cause itching, and then it can cause pain, discomfort. And if it's weak enough, you can have prolapse of your whole rectum, and your whole rectum falls out. I've had a lot of patients who have really severe hemorrhoids. Sometimes you have to remove it because anatomically there's not a way to reverse it, but if you don't treat the root cause, that hemorrhoid can come back, right? So you have to learn to treat it conventionally if you need to, but you also have to add in other modalities to really give you best outcome and prevent recurrence. So chronic constipation or diarrhea can cause straining during bowel movement. So a way that you can help those who already have some hemorrhoid, but it's not severe, a way to manage this is that when you're straining, you have to also contract your rectum so that you hold that area in as you push down. It's hard, but you can do it, right? And that's going to help you strengthen that muscle because you're using that muscle. So it's not just about Kegel exercise. Kegel exercise help a little, but you actually have to engage the whole muscle group around the perineum area, which is around the anal area, and be able to strengthen that muscle to prevent recurrence. And you can control it much better. I said pregnancy, obesity, just because a lot of pressure. It's all about gravity when it comes to hemorrhoids, right? And sedentary lifestyle. As you can also, certain people, the way they sit, the way they sit on, being sedentary work, sitting at work, that is one of the major cause of steroids. So increasing fiber, fluid intake, right? Sitz bath, topical cream, ointments, again, temporary treatment, but changing your diet and your lifestyle, again, is really the main way to treat. And then you could use supplements like horse, chestnut, butcher's broom. They all work really well. And then if you have to, you can now burn it off. They put a band around it and they tie it, and then eventually it slowly burn off the tissue, but over periods of day, and then that hemorrhoid just fall off. I think if it's severe enough, that would be my route to treat that. And then you just have to do everything you can to manage your bowel movement where your stool is soft and it's not hard, right? If you can maintain the stool soft, you should never really have issues with hemorrhoids. All right, so at this point, I want to invite you to look at your conscious health toolkit. This is where you're going to really see your gut restoration checklist, and then best time to take your digestive supplements. And you're going to be able to look at not the supplement protocol, it's going to be the labs. So for now, we're just going to focus on the labs, and later on, I'm going to share with you supplement protocol that you can take in order for you to get better. I will see you in the next module. Thank you.